My name is Dr. Harpreet Kohli. I'm the Director of Public Health within the Department of Public Health. The annual report looks at the things that have been undertaken in the past year on a whole range of public health issues, whether it's around health protection, health improvement, whether it's around health services, and we also have a section on oral health. So it looks at those things. It also provides a review of some of the actions that we highlighted in last year's annual report and reports on how things have progressed on them. The main highlights, I would say, are around some of the work that we did around the Wishaw tyre fire risk, which presented a risk not just to Wishaw General Hospital, but to the population of Lanarkshire from a huge number of tyres which were in storage in a nearby centre. The Department of Public Health has a responsibility for looking at emergency planning and also business continuity. We were part of the team within the board looking at preparations for the Commonwealth Games more generally, about ensuring that we had the services, both primary and secondary care, ready if there were any incidents, both in the events that happened within Lanarkshire, but also in case Glasgow wanted to call on our services. In terms of public health, we were particularly interested in emergency planning. For example, if an incident happened at any of the events in Lanarkshire, or if there's a health protection issue, for example, an outbreak of gastroenteritis, food poisoning, things like that. We worked very closely with the health improvement team on looking at the no smoking policy that we had. We took on board the revised guidelines from Scottish Government. We undertook a survey of staff, how they felt about the no smoking policy, and we took that to our board. In that, we got support from the staff side, from that is the staff of NHS Lanarkshire, and we also included a section on it on e-cigarettes. We have a consultant in dental public health who works very closely with dental health services, but also oral health improvement. And through that, we're able to provide services which are appropriate for Lanarkshire people, particularly young people and children, and also initiatives that help bring people in to oral health services. And that includes disadvantaged communities such as migrant communities, gypsy travellers, prisoners and so on. As part of the health protection team, we have a responsibility for looking at any increase in infectious diseases. And we noticed there was an increase in cases in syphilis within Lanarkshire. And as a response to that, we worked very closely with schools, with sexual health services to provide the services for young people in particular, but also kept the primary care team, including general practitioners, appraised of the situation and what they should do if someone presented with symptoms of syphilis. I hope readers will get a sense of the vast range of things that public health is involved in, but it's not just our department that does public health. It's everyone within the health service and beyond, because we have colleagues working in local authorities, for example in health inequalities, that undertake public health activities, and that's important to remember.